I'd like to welcome everybody to the February Franklin Grandisle Community Partnership meeting. As always, thank you very much for taking time out of your schedules to be here either in person or via Zoom. It's greatly appreciated. So the other thing we want to do is turn the lights on, I think. So I'm going to turn these on only because it's better for the camera. Maybe I should have left the other ones on too. So anyway, as we typically do, we want to start the meeting with introductions, yourself, title, organization, something that you're grateful for. And if you go over the allotted 40 seconds, you get the bell. And also any first-time attendees, you get a happy bell. So we'll do that as well. So Melinda will take us, I believe, around the Zoom screen first, and then we'll do the in-person gathering.
Okay, so I'm going to start with the order that I have people on my screen. Janice, you're up.
Good morning, everyone. I am Janice Santiago. I am the Garden Lighter and Regional Coordinator for Franklin, Grandisle, and Chittenden counties. So this is actually my first time meeting with everybody here. The sunshine, but I wish it was warmer.
Welcome to our team. And Janice, can you put your email address in the chat so I can add you to our listserv? Thank you so much for that.
And be prepared to sing your alma mater song at the conclusion of this.
Yeah, the song and dance is after introductions.
I just graduated from the University of Missouri with my master's degree, and I have no clue what that song is.
Well, first of all, Janice, he's kidding you. So, he's trying to bring some anxiety into your life. So.
Way to go that way early.
Yeah,
Okay,
yeah.
next person, Amy Brewer.
Good morning, everybody. I'm Amy Brewer. I'm the health educator at Northwestern Medical Center, the coordinator for the Franklin Grandisle Tobacco Prevention Coalition, and the regional coordinator for Local Motion's Safe Routes to School program. I also, Janice, am super appreciative of the sunshine. It is making me feel a whole lot different than I felt a week ago, so I'm super happy for it.
That's why she's staying in her house, not
Thank you,
coming out
Amy.
to come to community partnership.
Next person is Kate Greenwood.
Morning, everybody. I'm Kate Greenwood. I am the Vermont Area Manager for AverHealth. I'd love to jump on the sunshine bandwagon with everybody else this morning, but as much as I do love it, I am thankful this morning for volunteers. My son finished up his basketball season last night with 2 amazing volunteers from the community, and I really appreciate the fact that they stepped up for our youth.
Awesome. Thank you, Kate. Ali.
Yes, this is Ali BDF, Regional Manager, Coburn, Chittenden, and Franklin Grandisle. I am thankful also of the sunshine and would have loved for it to be a little bit warm. But yeah, very good. So also I have a question about this meeting. Does it start at 8:30 or at 9?
So the meeting itself starts at 9. The networking and arrival is between 8:30 and 9. I think since COVID, it's made it a little bit confusing because historically it was in person only. So people would get coffee and network between 8:30 and 9, and then we'd start at 9. So when people are joining by Zoom, it's probably a little bit less stimulating to hang out for a half hour. So you're welcome to either unmute yourselves and communicate amongst each other, or just join a few minutes before 9.
Sounds great. Wonderful. Thank you. And John, I will email you. I received a description of the documentary in details, what it entails. Thank you, guys.
Thank you. Janine.
Sorry, took a second there. Good morning. I'm Janine. I'm the Development Communications Director with Vermont Adult Learning, calling in from South Burlington today. And I am grateful for we're now on the 3rd consecutive day of sun, which is a very pace. I'm incredibly grateful for that. This is not the state for me this time of year, but I'm grateful to get a little bit of sunlight and to be sitting near some windows where I can really feel it. So I'm glad to see you all today.
Thank you, Janine. Megan.
Good morning, everyone. I'm going to jump on the bandwagon about volunteers. I am so grateful. And most of you have probably seen the article in the St. Albans Messenger about my colleague and his mentee, Awen, through Franklin County Caring Communities Watershed Mentoring. I am in awe of anyone who is able to mentor, and I am grateful for all Mahat does. If you haven't seen the article, I'm going to share it.
You muted yourself. Whoop, you muted yourself.
Megan, relax.
It's me and technology. I don't know if this is going to work, but I hope you can all see it if you haven't already. It's a really sweet story, and thank you to anyone who mentors.
And Megan, and I'm saying this for Melinda, but I think what we can do is find that story and put the link into our minutes or in the weekly updates.
And the weekly updates,
I think the weekly updates, because that will get, much broader distribution.
That's awesome, and there's an absolutely adorable picture of them as well, if you put that in.
Yeah, if you want to email that to me, Megan, that would be amazing.
Okay, cool. And I don't see Crystal here, but they need mentors, so I'm going to shut up.
She's here.
Yeah, she just got here. It was like you planned
She
to
snuck in under the radar.
By the way, Megan, number one, you didn't tell us what organization you're with. I know everybody knows, but still.
Oh.
And number two, you went over 40 seconds.
Darn it, Joe!
So welcome to the first Wednesday of February.
Megan Bridges, United Way, Northwest Vermont.
Thank you, Megan. Deb?
I am Deb Quilliam. I am the supervisor for AgeWell, Parent Service Coordination Team. And everybody stole it, but I'm really thankful for the sunshine. I have needed it so badly, and it's shining in on me right here. I'm also thankful that I work for an organization where I can work from home because I got COVID, and I am able to still work and get things done. So I'm also grateful for that. I'm glad to be here.
I hope you get well quick, Deb.
Yeah, get well
Thank
done.
you.
Barry?
It's like having a really bad head cold,
Yeah.
except for the fatigue that doesn't necessarily come with a head cold.
Right. Barry?
Good morning, everyone. I'm Barry Latke. I'm the project manager of Housing for All, which supports the creation and improvement of housing in Franklin and Grand Isle County. About a year and a half ago, we created a housing needs assessment that really kind of put a fine point on the housing needs for the people of Franklin and Grand Isle County. It did not cover the last couple of years. It only went through 2020, because that was based on census data. So we wanted to share the stories of how people have been navigating the housing crisis and put a face on the data for the housing needs and really drive home that the people who are looking for homes are just not people from away. They're our friends, our neighbors, family, fathers, daughters, and employees. So we have just launched our video series called Voices from Home, and it really shares how people are navigating the housing crisis and where people can turn to for resources. So I will share with Joe and Melinda a newsletter article and social media post that we would love for you people to share with your colleagues and your constituents to share those stories to really drive home what the housing need is in fact in Grand Isle County. So I'm grateful for the people who have shared their stories with us, and I'm grateful to the people who have connected us with those people who have helped produce the series. So people like John and Joe and Northwest Access TV and everybody else who has helped put us together to share this story.
Thank you, Barry. I'll
Thanks,
keep an eye out
Barry.
for that email.
And I hate to do this, but you also went over. But this is good going over. And by the way, I do want to say that these videos are amazing. They're short. They're people of all walks of life, people looking to rent, people looking to buy, a lot of different circumstances that tie into when we talk about the housing situation, not only here but everywhere. So anyway, they're very well done. So thanks, Barry.
Awesome. The next one that was on my screen, Katie DeForge, and I think you might also have Katie Doyle with you, so if you all would like to do your intro.
Hi, I'm Katie Doyle. I work at Turning Point in Franklin County, which is me currently. And we're doing the thing I'm grateful for, correct?
Yes.
I'm grateful for, I don't know if I'm the only one that can feel this, but although the wind may be colder now, the earth is starting to warm up. I feel it when I walk, so spring is coming. It is coming, just not as rapidly as I would hope.
Awesome, thank you, Katie. Beth?
Hi, I'm Beth Burgess. I work for Vermont 211. I'm a database curator and marketing specialist, and I'm grateful for the sun as well as my mentee, Hayden. I mentor for Everybody Wins, and I'm a big booster for mentoring too. Thanks.
Awesome, thank you, Beth. Lucy?
Hi, I'm Lucy with United Way Northwest Vermont. I am the AmeriCorps Vista in the Working Virtuous program. And I am grateful to be at my family's house in Waterbury right now, dog sitting. So, cute dog, beautiful mountains.
Awesome. If you'd like to dog sit for my dog, just for 7 to 10 days.
Starting immediately.
Adrian. After 3 weeks.
Hello, can you hear me?
Yeah.
Yes.
Okay, hi, I'm Adrian, Leaders Dumont. I also work at United Way in Northwest Vermont, and this is my first meeting.
Yay,
welcome.
welcome.
So I'm gonna probably come to more of them. And I work with Megan on the backbone team of the Prevention Network and also for our mental health initiative. And I'm grateful for dogs. I'm gonna say dogs.
Awesome, thank you, Adrian. Can I ask you to put your phone name and email address in the chat so I can make sure that I spell things right and add you to our listserv?
Yeah, definitely.
Thank you so much, welcome. Nicole?
Good morning, everyone. My name is Nicole Clements. I'm a resource coordinator for the Working Bridges program at the United Way of Northwest Vermont, which is a mouthful. I am grateful for, and I've experienced this quite a bit in the last week, the wraparound community resources and the fact that everybody kind of connects. And this meeting is a great example to support individuals. So when somebody's talking to one of us, they're actually talking to all of us. So I think that's really great that we can offer all of your supports and resources in every conversation. So I'm grateful for our community.
Awesome, thank you. Denise?
Good morning. Denise Smith. I'm the Blueprint Program Manager for the St. Albans Health Service area, which is inclusive of Franklin and Grand Isle counties. And I'm the Director of Population Health at Northwestern Medical Center. You know, everything everybody said, the sun, the people, the work, all of it, just very grateful. Thank you.
Thanks, Denise. And I think you did put a message in a chat to Faith about giving an eye pillow to Kate, please. I don't know if that was on the record or not, but it was sent to everyone, and I want to make sure.
And Melinda, I also put a thing in the chat about your dog. If you ever need a dog sitter, you know, I'm in, right?
Thank you. I'll drop her off this evening. I love
That's
you, Denise.
right.
Thank you.
No delay there.
I think we have. Did we get everybody on the screen? I feel like we did, but let me just double check. Is there anybody that I didn't call on the screen? Feel free to unmute yourself. Okay. So we will come into the room. Thank you, Adrian, for your information. So I'll come in the room and hand it over to Stephanie.
Hi, I'm Stephanie Comstock. I'm the director of the St. Albans Drop-In Center with Spectrum. And I'm grateful for coffee today. Just all the caffeine.
Do you need an eye pillow?
I do. Great.
I'm Brad Ferlin. I'm co-chair of the Substance Use Addiction Summit. It'll be our third annual, July 19th at Fairgrounds with Melinda. And I'm grateful I drove in here today on the dog theme. I have my Norwegian Elkhounds in the car, and they saw the Northwestern Counseling and Support sign, thought I was bringing them here for counseling, and so they're in the car talking about stealing cat food from the counter and bringing it to the couch. So it's a productive morning for us.
Aw, Mr. Nugget.
Hi everyone, Suzanne Tremblay. I am the Regional Manager of Operations for Savita Health. And what am I not grateful for? That's what I'm grateful for today. Love it.
Hi, my name is Stephanie. I work for Vermont Psychiatric Survivors as a peer community advocate. I am grateful for two things. Getting to know my fellow community organization, Savita. I just had a conference with you guys, not really conference, but to get to know you guys and Amy, and it was beautiful and I loved it. And I'm also grateful for my very close friends that I went to Lund with, and Lund, because now we're starting to get out into the community to hopefully change the stigma about the ladies that go there, and about addiction and mental health, in hopefully a podcast. So nice. Yeah, that's what I'm grateful for.
Awesome. Thank you. And Emily Aiken, it's my first meeting.
Welcome.
I am in grad school for clinical mental health, and so I'm taking a course on addictions, and then I'm looking to learn more. And I am grateful for the sunshine. It's been really nice.
Welcome,
Hi, I'm Faith DuBois. I'm a community health worker with the Abenaki Nation of the Missisquoi. And I'm sorry, but I'm so grateful for the sun. I can do this for 40 seconds if you want. This is to me.
So in other words, you had a rough January.
Thank you for breaking up. We couldn't hear what you were so grateful for.
Someone did tell me that this January was the cloudiest that we've had since 1951, and I so belated. Yeah, so yes, rough. It came following the death of my dad, so it was not nice, but this is wonderful.
Yes. I'm Kate Gladison. I'm the Director of Communications at NMC. And I'm grateful to be here in person today, even though Amy is not here. It's just nice to see familiar faces and meet new folks, and it's just really lovely.
I'm Krista Landman. I'm the Executive Director of Franklin County Caring Communities. And I am grateful to have the opportunity to spend some really great one-on-one time with my kiddos. The Owen that Megan referred to is my 8-year-old. We are ever so thankful for Mahat as well. But Owen and I got to go to a basketball game up in Enosburg last night, spent some time with Amy. It was a lot of fun.
My name is Mary Pickner, and I'm the Substance Use Prevention Consultant for the Division of Substance Use Programs at the Vermont Department of Health. That's like 20 seconds there. I'm grateful for two things. I'm so grateful for the sun, but I'm also grateful that we have a new car. Downside is I don't really know how to drive it when it starts telling me things. It's like looking at mission control. So it took me a little while to figure stuff out to get here, because I got in the car and I went, I have a car starter, which is amazing. But then I was like, why is there frost? Why is there all this stuff? So, but I got here, and I'm grateful for the opportunity to be able to own a new car. Yay! Thank you.
Yeah, that's great.
I'm John Gorton, Sheldon United Methodist Church Food Shelf. and I will break the mold and not mention the. But I'm thankful for a couple of things. I also, in addition to the bowling session 2 weeks ago, my granddaughter scored her first ever basket in a competitive basketball game at the middle-level basketball game in Hardwick. So I've been making about 3 round trips to Hardwick every week for the last several weeks. And we got it on video, no less. And I'm also grateful, those of you that remember Larry Christ, who came and made a presentation a few months ago. The House introduced a bill to reform the child protection system and reform the way that substantiations in the Child Protection Registry is run. And Teresa Wood, the chairman of House Human Services, has indicated she is going to ensure that that bill goes through and gets passed into law this year as part of this session.
Wow.
And here's a copy of the cover of the Sheldon Town Report, which is dedicated to our food shop. It'll be a lot of fun.
Excellent. Thank you, John.
I'm 40 minutes. Did I say 40 minutes?
40 minutes. What is seconds?
He keeps trying, he keeps trying.
Yeah, really.
Good job.
Pushing the envelope. I'll try to stay within 40 since I'm trying to keep everybody up. I'm Joe Halco, Director of Community Relations here at Northwestern Counseling and Sports Services. And we talked about sons and all the various things that you've talked about, which I totally agree with. I am very grateful. Last Monday was the 9th annual Mental Health Advocacy Day, where we try to, speaking to the legislature, put a highlight on mental health, substance use, and developmental and intellectual disabilities. And it was attended by, I believe, nearly 300 individuals throughout the state, and it was an impactful 4 hours. And on top of that, they had an award called the Unsung Hero Award, which one of our staff members received. Her name's Sam Weber, and she's embedded in the St. Albans Police Department as a mental health clinician, and for years has been going out with our local police officers to de-escalate situations, and it's worked magnificently. So anyway, I was really glad to see that she was one of the 4 individuals throughout the state that received the Unsung Hero Award. So it's really grateful.
That's awesome. Wow. I'm going to give Will an opportunity to introduce himself, even if you just want to say your name and something you're grateful for, and not to put you on the spot.
No one's ever talked to the cameraman. This is uncharted territory.
It helps me do it every month.
Well, Will, one thing we know is this is your first meeting, so here you are.
Welcome.
Thank you.
Well, and we appreciate you being here. I just want to give
absolutely.
a public thank you for you helping us today. My name is Melinda White. I'm the recovery coach, supervisor in the emergency department, and MAT Blueprint lead. And Amy, I feel it. I feel your pain. I'm trying to reduce the title. So I am grateful that we are working on our 3rd annual Substance Use Addiction Summit at the Champlain Valley Expo on Friday, July 19th. Shameless plug in there, but also it is what I'm grateful for. And I'm grateful that in Brad and I starting to do this work together, getting reconnected with some partners that I may not have communicated with for a couple of months, and just kind of starting the process of how we can share we have a relationship with Savita, so I'm super excited and grateful that Susie's going to be sharing the services that Savita does, because that has been a lifeline for the work I'm doing in the emergency department. And just, again, getting reconnected with all of those different organizations that supported the Substance Use Summit. My hope and goal last year, we had 92 different organizations from New England. It wasn't just Vermont organizations. My hope is to see us at 100 this year. So feel free to spread the word, send messages if you have ideas, if you want a booth, and keep your eyes peeled for ongoing communication. And grateful for the sunshine, and that Denise is going to take my dog for 7 to 10 days. I'll tell you why after, Denise. I'll text you.
All right. So now we're going to have a quiz. No, I'm only kidding. Okay, so once again, welcome everybody this month. Let's do the minute approval from January 3rd next, which you have in your packets. It was also emailed to everyone. So do I have a motion to accept the January minutes?
I'll motion.
Okay, Mary, and do we have a second?
I'll second
Susie? Okay, second. Any discussion? Okay, all in favor, say aye or raise your hand. Anyone opposed? Okay. So,
Recording in progress.
okay, so now I'm going to turn the program over to Suzanne Tremblay. And she is from Sevita Health, and you all have information in front of you that she has provided for you. This is a medication assistant recovery specialty practice that provides respectful, compassionate, and effective treatment, and they've been doing it since 2010. So once we get the screen finalized, Suzanne, the floor and the screen are yours.
Okay, so that. All right. I
Okay.
think we're good.
I think you're good.
Thanks, Melinda.
You're welcome.
Hi, everyone. I'm grateful to be here today, and you know, I said earlier, what am I not grateful for? Well, I will say that I'm extremely grateful to be able to present to you and my community. I live here in Franklin County, and we've been doing some amazing work at Sevita, but really through the partnerships we've made throughout the county and throughout the state. So I'm just really excited to be here and present to all of you, my colleagues, friends, and family. So Sevita Health, we are an outpatient addiction medicine specialty practice. We've been providing respectful, compassionate, effective medicated assisted treatment for alcohol and opioid use disorder since 2010. We started out as an organization in Massachusetts called Experience Wellness. Our medical director, Sue Carey, is still with us, and we still hold the values that Experience Wellness put into place. Wraparound care, counseling, full patient-centered care. In 2014, an organization called Capital Council came in and said, you know what, this is a great organization, we'd like to help support you and launch your efforts more globally. And so we are now in 7 states up and down the East Coast. Maine, I think, is our newest. No, I'm sorry, New Hampshire is our newest. So Maine, New Hampshire, Massachusetts, Virginia, Tennessee, Delaware. My memory doesn't serve me every time I try to say it out loud. And on this one. But most importantly for today, Vermont. And we are located in 9 locations and 1 co-location throughout Vermont. So we span the state and are looking to expand. Who we serve. Adults 18 and over. We provide treatment for folks with co-occurring mental health and substance use disorders. We provide support for pregnant mothers, those in probation, parole, and other diversion clients. Accept most insurances, Medicaid of course, Medicare, most private insurances, and then we do provide a sliding fee self-pay plan. We also staff insurance navigators throughout Vermont to make certain that if anyone is struggling with payment, that we have the care and care coordination needed to get patients the support they need.
We're going to pause for 1 second because the slides aren't moving for people on Zoom, even though we are seeing it. So let me try to redo the share.
Okay.
Sorry about that.
That is okay. At least we can.
Suzanne,
Are you
while
guys
we do
seeing
that, a
on
question?
Zoom? Can you hold on 1 second? Zoom, people, are you seeing if I change the slide now?
Yes.
Okay, perfect. There we go. Okay, so let me put it back in play mode.
You had a question, John?
Yeah, for the mental health support, do you do that out of your office, or do you do that like in coordination with
Both.
mental health people in CSS?
Both.
Okay.
Yeah, so we partner with outside agencies, and we also staff licensed clinicians in-house as well.
Now the slides are gone completely.
Oh, no. You're gone completely.
Okay, bear with us, because, yeah,
Is that
it's stuck
Amy who
on
said
this
It's Amy's
end.
fault. It's all Amy's fault.
I was seeing something
She's having a
different.
rough
Okay,
day.
so let's.
Yeah.
We're gonna try one more
Andy
time to
says,
share the
not only will I
screen.
not come in person, I'm not even gonna show up on ever again.
Okay, do you see who we serve?
Yes.
Okay, so I'm gonna put it back in play mode.
Current slide.
Okay, now do you see who we serve again? Do you see changes happening? Okay, beautiful, we're good.
Awesome.
Oh wait, is that a no?
It didn't change. We just see who we serve.
Is that what it is? Because there's all.
Do you see what we do now?
No.
Do you want to just go to the slideshow without
I think
the
we
thing?
might
Yeah,
have to,
that's okay.
yeah, so sorry about that.
Oh, it's all about the
Nothing in my
conversation.
title says anything to do with technical.
Yeah.
So just-
Yeah, right.
Okay, so let's try this. Okay, will it let you change from there? It's not even. And if there's anybody who actually has any technical training, don't hesitate to come up here and help me.
Oh, you know what? I can go get Justin.
I wish.
We know
I need this thing.
Yeah, we know.
Jeez.
We have friends.
And then do share screen. Let's try this one more time. Yeah, it seems like as soon as I do play. Okay, do you see what we do? Perfect.
Yes.
Do we need to go back?
No, that's okay. We
Okay.
can start from here.
Thank you.
I think we made it through all the other stuff, and I'm sure everyone was listening intently, so. All right, so who we serve, we just talked about, and what we do. So, as I mentioned, we're medicated assisted treatment for alcohol and opioid use disorder, but we are so much more. We are not just sitting down with folks, prescribing, and sending folks away. We are a specialty care practice, and here in Vermont, we are associated with the Hub and Spoke, and we staff RN care managers and spoke counselors as well. We provide medications like Suboxone, the injectables Sublocade and Brixadi, and Vivitrol as well. We do prescribe other, but these are the most prominent at this time. We do provide psychiatric mental health and medication management to patients in our care that need it, but we oftentimes will work with our community partners to facilitate those that need some higher level of care than what we are able to provide. So we staff RN care managers that coordinate care across the social determinants of health. I will say last year my focus was on hiring all the RNs and training them up and getting them to where they are now. We now have 12 nurses across the state, and we continue to learn how to coordinate and be the most effective care coordinators that we can be. As I mentioned, we staff, or 3 of them so far have become insurance navigators that support all our patients across the state. And I had a couple of notes here. The RN care managers are our lifeblood, and so we're extremely grateful for the Blueprint for Health and its dedication to supporting folks in substance use disorder and the model that they have created. None of our other locations staff RNs, and I would say that it's a blessing here in Vermont that we have that. Not just us, Savita, but the community at large. So, counseling and recovery planning. We do staff licensed counselors across the state as well. If anyone's, looking to provide support, we're hiring. Again, last year we worked on bringing on our counselors, and we're finding many of them want to work from home, and they have this really great gig, I think, from home. But our premise, our model is really based on in-person visits. we believe wholeheartedly that someone should at least come in as often as they can, but we do remove barriers to care and have virtual visits available because we know transportation can be difficult. Though we do really appreciate having folks on site. So we're taking our time and recruiting some counselors on site. We provide Hep C treatment to our patients, on-site toxicology through our own lab. So we started out in Massachusetts as substance use specialty practice specific around our lab. So we still send all our toxicology screens to our Massachusetts lab. And we get next day results. Typically it's priority overnight and next day results. We started testing for xylazine, I think by September of last year. So we've really been able to find our pockets of folks that need the additional care. And then we were a part of the CORA xylazine test strip pilot program here in St. Albans, so we've been able to provide test strips for those here in Franklin County. We now provide on-site phlebotomy across our footprint. Providing good care to our patients is extremely important, and one of the barriers to care is folks, having to go to multiple healthcare appointments. So if we're sending folks out to get their labs drawn, honestly, they don't tend to get them done. And we want to make sure that our liver function and other levels are appropriate for care, so we started doing our own on-site phlebotomy, which has been going great. So it's really optimized the care we've been providing this year. We started doing pilot programs across the state. We've always provided support for those that are titrating down and off of methadone, but we've really taken hold of this process and put in some additional procedures where we connect with the hubs and ask for their support during that titration process. And so we've been doing a macrodosing pilot across the state. More to come on that. I haven't, one thing that I've noticed that it has come from it is the deeper connection with our hubs. So if that's the end game, that's the end game for me. I think that coordination of care is crucial. And if anybody wants to know what the hub is, that's your methadone clinics, the daily dosing of methadone. And when folks want to enter a lesser level of care, they'll come to a spoke, which is what we are. It is more of a weekly visit as opposed to daily, as folks make their way through recovery. Comprehensive care, we've always provided some form of comprehensive care. Now we are looking to actually bring on site an NP that will provide on-site primary care in Springfield and Brattleboro. As I mentioned, everywhere we do provide, a comprehensive care as a stopgap. So if someone's coming in, that it has a tooth infection and they're struggling to get in with a primary care provider, or they just need something at that moment, we will prescribe. But we're looking to expand that and see what it would look like. Not to become the primary care provider. We do recognize that everyone should have their own primary care and work diligently to set our patients up with their local primary care provider. But in the meantime, as they're waiting, or if folks are just struggling to not be set up with primary care, we're there to lift them up and hold them as they need to be. Excuse me. Did it change? No?
No.
It didn't. You might have to manually arrow down.
There we go. Okay.
Yeah, the play mode is not working for some reason.
All right, perfect. So I'll stand here now. This works for me too. So our interventions, as I mentioned, from the beginning in Massachusetts, we did, provide care from a care team approach, a multidisciplinary team approach. In our other states, that doesn't include the RN, so here in Vermont, like I mentioned, we have that full wraparound care with an MAT provider, an RN care manager, and a licensed social worker, LADC. Our spoke RNs from the get-go are looking at the patient's whole care needs, their social determinants of health, providing harm reduction bags, community-specific resources, smoking cessation bags, wound care kits, Narcan, cell phones. So over the past 2-3 years that I've been with Sevita, we became a Narcan distribution site. We've connected with the Vermont Department of Health to make sure that we have harm reduction bags available to all our patients. We work with Cora in all of our rural locations. If anyone knows of a good connect in Chittenden County, let me know. To provide cell phones, wound care kits, lock boxes. If you're not familiar with Cora, they're the Center on Rural Addiction, and they provide amazing supports throughout the state and I think country. We provide healthy snacks and beverages. We know that our patients are coming to us sometimes on an empty stomach, sometimes without a home, and we want to make certain that the space that they come to is healthy, safe, welcoming, and warming. So we provide healthy snacks, beverages. Some of our locations have clothing drives and clothes available to our patients when needed. We have meditation rooms in Bennington for folks. We have on-site partnerships to provide additional supports and care as well. So over the past 3 years, I think, last year's focus organization-wide was on creating community partnerships. And as someone who understands what the Blueprint does and what that means as, to be a hub and spoke participant in the state of Vermont, we have worked diligently across the state to inform our area managers and care managers and counselors of the importance of the community connection. So we sit in on all of the MAT meetings across the state. It becomes extremely busy for me. And so you may not see me at all of them every time, but I try. The MAT meetings, the community health team meetings, we sit on some of the prevention collaboratives across the state as well, and continue to delve into and create deeper partnerships with our community. We have specific relationships with some recovery centers where we have set up co-locations. Removing barriers to care is important, so we have a place in Wilmington where we set up at the recovery center there to span the gap between Brattleboro and Bennington and meet people where they're at. We have partnerships with working fields that have come on site and provided workshops, and recovery coaches that sit in our space to provide peer support as needed to our patients. Same day, next day. We are a specialty practice, and we have a great group of providers across the state that are able to get patients in same day, next day. Referral is not necessary, but we have a referral email. It's on the handout that I provided, and then you also have each of our locations on there across the state. We're constantly screening for the right level of care. If a patient is not succeeding in our program, we are not saying that this is our patient and we are going to force them. We refer out to the appropriate level of care, and at all times we're making sure that we're paying close attention to that. My behavioral health director out of Maine continues to say the word compassion, or phrase, compassionate accountability. And that's what I feel we do at Civita, is provide compassionate accountability. Many of our folks come to the profession because they too have experienced or want to help either their family, their friends, their community, or they have lived experience. And we provide that compassionate care through a harm reduction approach and trauma-informed care. As I mentioned, we do span the state. We are in Bennington, Springfield, Brattleboro, Colchester, soon to be South Burlington. We are moving. I am very excited. I will be very busy for the next 3 months, making sure that that happens smoothly. We just signed the lease. Virgins, St. Albans, St. John's, Barry, Morrisville, Newport, Wilmington as a co-location. As I mentioned, we are trying to meet our patients where they're at. We recognize that though we're all across the state, there's still room to connect people in Enosburg. We've been talking with Melinda about possibly, is there a space, you know, where we can set up 1 day a week and meet patients where they're at. And, you know, they're traveling from Richford to St. Albans sometimes, and that's not easy. You know, there's a big, it's a big, small state. And so our goal is to open another 5 co-locations this year throughout the state, and we're looking at real estate in Rutland and Barry right now to open up some more locations, on-site locations. We have positioned ourselves to serve. We have 11 providers statewide, and in Massachusetts we have 2 providers that just became licensed in Vermont as well. What that means is we are able to see people same day. We all know that if someone is ready right now, if we don't capture that person in that moment, the likelihood that they come back is going to diminish every hour. So we are positioned. If someone in Colchester, it's taken a lot of training of the medical receptionist staffs and all the different locations. They're like, we don't do it like that here, you know. But no, we're going to have to. We are going to learn how to look across the state and find that provider that has 45 minutes to see the patient, and in Bennington, and that patient can present in St. Albans and see our RN care manager and Julia, our counselor, for support in our MAs and our MRs and the entire wonderful team here in St. Albans. We have 12 nurses statewide, and they provide so much care coordination, and they are continuing to learn and understand their role within the community, their roles as care managers. Not many of them came with a background in care management, but they're learning quickly, and they're understanding the dynamic and the, what do I want to say? Most nurses come and say, you know, I see someone for 2-3 days and then I never see them again. And they are so appreciative of being able to follow a patient and have a panel of people that they are servicing, you know, finding housing for, which is not easy, or connecting them with the resources for housing. We have so many amazing stories of folks that have moved through our recovery process successfully, and it's not just because of Civita, but it's because of the partnerships that we've made across the state, and I look forward to so much more. And I want to thank you all for your support and for hearing me today. And I think that's it. I have one last slide with just my email if you need to get in touch with me in our referral email.
Any other questions for Susie?
I'm just going to publicly say thank you so much for the work that you all are doing in this community. I feel like I've been a broken record over the last approximately 5-ish, 6 months as I've learned more of what Civita does, and I know I'm highly dependent on you all from my role in the emergency department and people that need that care now, not later. And the communication that comes from your team. I've been a witness to the follow-up because some of the people may give my phone number because they don't have a phone, and just, it's been really beautiful to see what I formerly knew as like a super spoke when we had the Hope and Recovery Clinic, which happens to be at the same exact location you're at. And I was really missing that type of work where an organization will do above and beyond just that one, and that's what you all are doing. And it is so exciting and refreshing because COVID really hit this community hard with that, not only spoke service, but the innovative things that you do of, you know, I keep using that saying, you know, a patient shows up with their pants on fire and we want to sit there and talk about the future. You guys put that fire out, whether it's a antibiotic, so then you can get to the next piece. Those referrals to primary care, the connections with our recovery and wraparound support. So I'm super excited with the work that you all do. I know it affects many people I've been working with for a lot of years. They're happy patients at Sevita, so that just warms my heart, and I'm really grateful for the work that you guys do.
Thanks, Melinda. I wanted to go back to John's question earlier when you asked about, you know, do we use NCSS or, you know, for counseling. We do have our own counselors. However, we recognize that it takes more than that, and so we do refer out to our community partners in that sense. But we also have just become a DCO, designated collaborating organization for HCRS as they take on their CCBHC status in Springfield, Brattleboro, and White River. So that means we're their NAT provider to satisfy that aspect of the CCBHC grant.
Does a lot of acronyms.
I know.
Yeah.
I'm so sorry.
Yeah, you need to let, that is so new to this state, you know, maybe you want to state the whole, what it stands for.
The community, oh my
Yeah.
gosh, so certified community behavioral health centers.
That's it.
So they are becoming, so your designated agencies are receiving funding, mental health agencies are receiving funding to also provide that, you know, stopgap and have all the services under one roof while they have folks there. And they can satisfy the MAT need by staffing or partnering. And right now, they're partnering with us down south, and the amount of process and procedure and collaboration that's happening with the two of, you know, entities right now is really amazing. You know, we're on Victoria Potter. She just took over the lead role there for the CCBHC, and their mobile crisis unit, 24/7 mobile crisis unit. So she and I meet on a regular basis to make sure that all these amazing processes and procedures we put in place are actually being, you know, worked on, and that it's working, and coming back and saying how can we better make sure that the HCR patient is receiving, or the HCR patient's provider is receiving updates from Sevita and vice versa. So.
On the acronym train, the CCBHC, one thing which Susie mentioned is that there will be a time when all designated agencies in Vermont are CCBHCs. What's happening, and this is not a Vermont thing, this is a US thing, national. And it's been rolled out for several years. It's very competitive, and Vermont was asked, you know, or has the ability to add 2 more designated agencies to this mix. And it's kind of a slow process. And my point just being that there's going to be a point in time where all designated agencies will be under that umbrella, if you will. Basically, what's happened from the federal level is that people are finally realizing that mental health, substance use, all of those things co-occurring, this is all real stuff that happen to people, and they need to have the available services, and you need to be accountable, which Susie mentioned as part of her presentation. But anyway, it's a whole other conversation, But I only bring it up because we're deeply in the throes of all that here as well. And the day will come when NCSS is just like HCRS as far as being under that umbrella. I think the game plan is by 2030 or something like that. Nationwide, these will be the new way to provide services. So.
And Melinda and I are on the steering committee for the Vermont CCPHD.
And we've had a free-for-all meeting so far, so it's still fairly new.
Yeah, it's fairly, yeah.
So, and one other thing I wanted to mention is that if anyone knows of any locations that would like to house us for one day a week and see patients, please let me know. That goal of 5 co-locations, is real. Yay? Oh gosh.
Yeah, here's the building.
Okay, John, we're talking after this. And then for our folks out in the land of virtual, my United Way folks, I have to get you my 211 updates because we just opened 5 days a week across the state. So every location is open 5 days a week. So we'll get you that information soon.
Awesome, and I see we've had 2 hands, so Amy, I'll start with you.
Okay, this is, Suzanne, I've seen you a bunch in meetings, and this is just the most great presentation of what it is. I kind of like had to backfill in my imagination because I feel like I've been in the middle of the conversation. So this is super helpful, and I predictably want to say thank you for handing out those cessation bags, and I wanted to say, if you or staff need additional training to really effectively address cessations on, alongside all the other things, let me know. I will help connect you with any resources to make that work successfully.
Thank you. I've actually given your name out a couple of times for here in St. Albans. So I think for resources it was specifically, but I will continue to do that. I think that's one of our focuses this year will be care planning, and one of our big measures of care is smoking and tobacco cessation. So thank you, Amy.
You're welcome. There's some, Department of Health has some great training resources right on their website for providers. And so it's a great place to start, but I will help in any and all ways I possibly can.
Okay.
Thank you, Amy. And I see Janice, your hand is up if you want to unmute next.
Thank you. I'm just curious if you've connected with the judiciary about the federal treatment courts that we have and are trying to grow across the state.
We just posted a fantastic new position called our Outreach and Admissions Manager, that is on my next docket. We have met with DOC at an executive level, WellPath, probation and parole, and our next stop that I would like is the treatment corps. But no, not yet. Not officially.
There's a lot there. I understand that, but I think it's a great place to really get your, become known, get your face and name in there. And I think the judges would also appreciate knowing what you do and that you're out there for the community. So if there's a way, I think they have in the summertime they have judge school type thing, and that might be a good venue for you to hit all the judges at one time.
Oh, that.
I'll follow up with you on some of that other access.
That would be fantastic. I'd appreciate that.
It's in June sometime.
In June.
And then the lawyers, the district attorneys and ADAs also do the same thing. I'm not sure the same week or 1 week and then the next, but that's a good docket to get onto.
When we talked to DOC, we talked about their need for having folks almost right on site at the courthouses because of sometimes folks are released without any discharge planning and we lose them at that point. So this would be a really great continued conversation on how we could support that need.
It's actually called Judicial College now that my brain rolled out. It's called Judicial College, but I'm happy to help try to make some introductions and connections around that for you.
That would be fantastic. Thank you, Janice.
Any other questions?
Okay, well, thank you again, Suzanne. This was terrific. And, you know, a lot of this discussion that's followed is one of the great benefits of this meeting, is getting people that you can get connected with to continue to move initiatives forward and collaboratively in our various communities. So with that, I don't know if anybody has any announcements about upcoming events or other things. Also remember that each week you can send your any kind of updates or announcements or anything you want to share with our members to the Franklin Grandisle Community Partnership email address. And Melinda does the mailing each week on updates. So just to kind of keep everybody immersed in whatever is happening with your organization that you want to let the community know about. Other than that, I don't know if anybody else has any, yes, Kate.
Kate. We just started a collaborative support group partnered with NCSS for folks who have, who are dealing with infertility issues or who have suffered a loss. And we just had our first session, and it was well attended, and just the folks who came were so appreciative, because there isn't really a resource like this around. So it's just been a wonderful collaboration with NCSS and also Northeastern Reproductive Medicine. So just kind of wanted to put the word out that that's available now. They can send them to me, and I can get them connected in. Thanks.
Yeah, thank you for bringing that up, because that was the inaugural.
Yeah, that was the
last
first
week.
session. Yeah, it was just last week, that's right. And it was great, people were just touched to be able to get together on this.
On the more mundane and fun side of the world, save the date, March 9th, Saturday, March 9th is the Model Railroad Show at the Collins Burley Sports Complex. Bring your children and grandchildren, let them run my train. I'll be there. It's a great day, a lot of fun. They have the whole tennis area of the Collins Burley Sports Complex is laid out with, I mean, they have some of the big, huge, you know, train layouts, the Northwest Railroad folks from down in Essex, and there's a group from over in Plattsburgh that comes and makes my board look kind of small. I'm one of the only people that actually let the kids run the trains. I generally draw a crowd. But it's a fun day.
Oh my goodness.
It's
Well-
pretty, it's like $5, you know, it's like $5 or something. So it's not an expensive day. Until your kids say, Mom, Dad, when are you gonna buy me my train set? Then it becomes an expensive day.
And I'll do an update for, I guess, two quick things. So one is I mentioned the 3rd Annual Substance Use Addiction Summit, so that'll be Friday, July 19th at the Champlain Valley Expo. We're looking to get, as I said, the hope and goal is 100 different organizations to host booths. Everything is free of charge. So booth holders, we don't charge booth holders, and it's open to the public. That's kind of our goal. So there is no charge to any booth holders, to the public. And that being said, we're in the portion where we're soliciting some sponsorship. And also just any organization that would like to host a booth. We've had everything from large, you know, UVM sometimes might have 4 booths to some smaller nonprofits that might share a booth. So we really look at, and I'll have Brad interrupt me if I say anything that isn't in alignment, but we're really looking to make it as all-inclusive as possible. So everything from medication to abstinence to faith-based to secular to wraparound services, we want everything and everyone, so when people attend they are able to see all the options and just learn and find what would work best for them. And then the summit presentation, we haven't finalized the list of the presenters yet, but we'll do a similar presentation as we have the last year, where we have representation from Montpelier. We have Monica Hutt and Dr. Levine. last year, the prior year, Dr. Levine, we're looking to connect with the governor and potentially have him, and then some different partners share some of the fantastic work they're doing in hopes that we can replicate it in areas of the state that aren't already doing it. So it's really to highlight those models that are working, innovative, evidence-based, and are able to support organizations that would like to start doing a little bit more. And I think our presenter today was just the perfect timing of kind of reintroducing this summit, because this is exactly what our goal was to highlight, is even though you have a spoke provider, all of these extra things that they have incorporated in their practice because they know that treatment and recovery is not in a box. So they're demonstrating that with what they offer. And then the other thing I wanted to throw out is there's an event on March 9th, on Saturday, March 9th at Jenna's Promise in Johnson, Vermont. And a gentleman named JP, Jonathan Phillips, but JP is going to be performing his theatrics called My Time. It's not super long, I think it's like a 10-minute theater type of thing, but then it'll open up for Q&A, and it's focused on recovery. So I'm gonna make sure to get that out in the weekly updates this week as well, and would love to, John is awesome. JP is just, his personality and charisma is infectious, and I want to try to highlight this event as much as possible because I think it's going to be something that people who attend won't forget. So that's what I have for updates.
And I have another one. On the serious side, this is serious now. I will send to Melinda so she can put in the updates in the weekly updates. There will be a showing in St. Albans.
Oh, yeah.
There will be a showing of Bess O'Brien's documentary film on hunger. It'll be at City. I think it's in City Hall or the museum. I think it's either City Hall. I'll send it when the date is when it's going to be here in St. Albans. So folks can go see it. For those who know, Bess O'Brien, documentary filmmaker in the state, spent last summer. She collected about 90 hours of video interviews. Several of the folks at Community Partnership will probably know she interviewed Jess Graff. She interviewed me at the Food Shelf Building, and she condensed that 90 hours down to, I think it's an hour and a half or something like that. But documentary film that'll be being shown all across the state, but it will be here. There will be a showing here in St. Albans. So.
A week after JP and the Trains make their appearance at College Pearly on the 16th and 17th of March will be the 30th Annual Home and Recreation Expo, which is always fun for individuals, their families, and what have you. And anyway, it's the 30th anniversary of the Expo. It's the 100th anniversary of the club.
Wow.
And how much has been done over the 100 years as far as giving back to the community. So anyway, that'll be a fun couple of days for families to kind of get out and enjoy some time at College Pearly.
My
So
daughter is
it's
still
long.
talking about meeting Elsa.
Oh, is that right?
Just last week she brought it up.
Are they going to be back again this year?
We'll see. Yeah, well, maybe not them, but we'll see.
Elsa and Anna.
Elsa and Anna.
We were on
My
a mission to find those.
my youngest granddaughter has an Elsa costume that is the only thing she will wear day in, and she sleeps in it. She wears it all day. It's the only thing she will wear.
I see that we have a hand. Amy?
Amy, how can Amy have anything to say?
I know, if I were in person, it would be, anyway. I wanted to share, next week, although this is not something everybody will choose to go to, but the youth are going to Montpelier to talk to their legislators, about things that are important to them, especially in the realm of mental health and substance misuse prevention, especially tobacco. We do have a team of youth going from MBU. But I wanted to share with you all, since we generally interact with our legislators, that the legislators are receiving a ton of push from the retailers, the wholesalers, and the Grocers Association, all of which partner with the tobacco industry to really take S18, which is the restriction on flavors and menthol. The arguments are scare tactic E and one-sided, and I encourage you all to remember that we are vastly outmatched by the tobacco industry. So if you are inclined to let your legislator know how you feel about stuff, your voice is really important, because otherwise the voice that they're hearing is the industry's. So I'll stop there.
Thank you, Amy, and actually, thank you so much for sharing that, because I realized an event that I meant to share, I thought of at the beginning of the meeting, Recovery Day at the State House is Valentine's Day, February 14th, and it is a virtual event only, but want to encourage people to attend that if possible, the Recovery Day at the State House to celebrate recovery. The other piece was, there's a bill that a few of us testified last week, was it? In favor of Medicaid reimbursing certified recovery coaches, and it feels like that's going a great direction. So if people want to drop anything on the ears of your local legislators in support of that, that would be welcomed as well.
Amy, do you have like a little talking point piece or something that you could send me? Just email it to me, because I'd be glad to talk to a couple of legislators.
We, and you know, to chime in with Amy, one thing that we can share, Amy and I have been visiting classrooms again, and that is one of the things that we hear every classroom that we have been in, is flavors is what makes vaping.
It's what makes
and
vaping
any kind
attractive.
of nicotine use attractive to young people. The flavors and the appearances.
Yeah.
So it's so clear.
And Amy, as you were speaking and talking about being outmanned by these industries, reminded me of a movie that was done, I don't know, maybe 15 years ago, called Thank You for Smoking. I don't know if you've seen that or not, but people from 3 industries, pharmaceutical, guns, and tobacco, all would meet weekly for a luncheon and talk about how they were getting over on, Congress or whatever. Anyway, it was an entertaining movie, but it was so real to what you're saying, and the fact that they have a ton of money and lobbyists who are very smart, who will look for any angle possible to, defeat what you're trying to do. So, carry on with the good work.
One of the things that when I texted Amy one night, I was like, I can't believe this, that when I think about as a person in recovery and a person who is in recovery from nicotine addiction also, is that the thread of, well, prohibition is one, but the thread of adult choice. And as a person in recovery, when you are addicted to a substance, it is never a choice. It's not a choice. Adult, child, doesn't matter. And so,
I'm not sure I understand.
That seems to be the problem here. And that seems to be the thing, is that, it's like, oh, we don't understand. And which is also about the education, where we think about addiction and we don't think about nicotine addiction. And when we talk about nicotine addiction, then people quickly move to like sugar and caffeine and all of that. But nicotine is, when I think about that addiction, not only is it incredibly hard to overcome, and it is relentless. When I think about my own recovery, I don't think about my recovery, my red flags of alcohol or other substances. The red flag comes when I smell nicotine or I, smell smoke. That's the trigger that I have, and that's how relentless it is. And so when I think of that, there is no adult choice for people who are addicted to any substance, but in particular, nicotine. So,
Well said.
It does. I just, because for me, we're not educating our public by feeding them a line of garbage, and that, I find that to be irresponsible, and I just feel like there is some responsibility and accountability to take care of our children, but to take care of our people. And, watching people slowly die, I think Davey, that addiction, he couldn't take it, and he died. And I have many family members that have struggled, but in particular, it's the instant gratification that you get, that's what we want. But the healthcare costs, but also the healthcare and the quality of life of someone who is addicted to nicotine is is, you know, on a downward spiral, but it's also relentless. My 2 cents, my 4 cents.
Yeah, inflation, yeah. Any other questions, comments?
Just another event announcement. If you have at home or are working with any middle school students in Franklin, Grand Isle, and Chittenden County, grades 5 through 8, are interested in learning leadership skills, we're hosting our 2nd annual Vermont Junior Teen Institute, March 15th through the 17th. So please reach out to me. I'm happy to send additional information.
And that is a reminder for anything, any initiatives, events, trainings that you want to share with the partnership, please send them our way, and they'll be included in the weekly updates. Okay, well, we're going to do something we rarely do, and you're going to have some found time. That's never a bad thing. 15 minutes of found time here. So I want to thank everybody for being at the meeting this morning via Zoom and in person. We will reconvene on Wednesday, March the 6th. Hard to believe it's going to be the 3rd month of the year already. But anyway, everybody keep doing the great work that you're doing throughout February. And we will see everyone on the 6th. And thanks again, Susie, for a great presentation.
Yes.